So but now let's talk about the military veterans particularly. The number of suicides in 2019 was 17.2. And it was the rate of suicide in veterans was 52.3% greater than for non-veteran U.S. adults. I mean, what's going on with our mental health crisis, specifically in the military veteran population? Some people that have, sacrificed so much for us, put their lives on the line. They come back home, and it doesn't seem like they're much safer back home than they were abroad.
Yeah, it's a very challenging issue. And the research that's been done on sort of predicting suicide suggests that a substantial amount of the risk for suicide in these people may actually have existed before they entered the service. So it's not only the stress of being in the military, but it's again this issue of who are we recruiting into the military, right? People these days, volunteer Army, often come into the military because their job prospects may not be great. They may not have a social support or so forth. I mean, out in the home, they may have challenging social situation, and that brings them into the military. So they are a vulnerable population or an at-risk population coming in, and then we expose them, worst case scenario, to trauma of combat. I mean, hopefully these days we don't have. I guess we're in one of these brief periods in the United States where we're not actually fighting a war directly.
Not directly.
Seems like that, but the history would argue that this is going to happen again soon.
Right.
It's whatever reason in the United States we're very quick to military conflict. So, so what's happening to these people, and why are we not reaching them? The VA is working really hard to. Again, it's really hard to provide these sort of wraparound services that are necessary, and the supports and the social supports. It's really important to understand that this is a medical problem, yes, but it's more than a medical problem. It's also a social problem and a community problem. And again, we have people that are with homelessness, addiction, people that may not have strong social support system. The VA is actually provides a much more robust mental health service capacity than exists outside the VA. So there are more resources. The VA pays a lot of attention to these issues like housing, assertive outreach to homeless people, mental health treatment, treatment for addiction, actually more than happens outside the VA. But, and could the VA do more? Sure. But the VA they've done a lot of sort of cool things to try and get ahead of this. So for instance, they've come up with big data approaches to identifying risks for suicide. So the VA, 7 million of our veterans about touch the VA every year, VA healthcare system, out of about 25 million there are. So many are not. But, and the ones that do tend to be the ones with less access to like private insurance or work-based insurance or that kind of thing. So the ones who are more needy, more vulnerable, and also more recently served. So they, for instance, they have a big data approach where they take all the data available about individuals in their data systems and do, analytic approaches to identify a population of people who appear to be at high risk. And then they reach out to them. They have suicide coordinators, suicide prevention coordinators from around the country who make phone calls, reach out, work to engage with people. So the VA is doing a lot, but it's a population that is, it's sort of, it's all of our responsibility. It's not just the VA's responsibility,
Right.
I guess is what I'm saying.
Yeah.
It's all of our responsibility to help these people and help them get through where they're at, and we can't lose, whether it's, and so for instance, you saw Jon Stewart and the burn pit stuff recently and so forth. We just have to, it's sort of everyone's responsibility to figure out what we can do to help these folks.
Right, but why? But at the end of the day, still, why is the suicide rate so much higher? They have, you're saying, maybe they were predisposed before the military service, okay, they have more service than, someone else in their shoes because
Yeah.
they're military veterans, yet their suicide rate is 52% higher. Like what
Well,
is
I think
causing
I
that?
think it's those two things that are accounting for it. That a high-risk situation socioeconomically and developmentally and support-wise and, adverse childhood experiences and all those things coming in. And then layering on that of the trauma. And then having, and then maybe having a hard time reintegrating, right, into society, entering into a society also where the chances of folks for gainful employment and good jobs, neighborhoods they can afford, the same people that working people everywhere in this country face now, is that population is facing it. And, and because that population is more sort of enhanced for those things and less well prepared in some senses, just makes them at really high risk.
If you had all the money in the world, all the resources in the world, what would you do tomorrow to be able to help the military veterans and their suicide rate and all their issues? If you could give them anything, what is it that you would give them?
I think I would give them housing, gainful employment, training if necessary for gainful employment, paths towards work, meaningful work.
Mm-hmm. What do you mean when you say meaningful work? What's that distinction? Because that's an interesting term. I keep seeing that term: purpose, meaning, meaningful work.
Yeah. So, like a job on TaskRabbit or something, right, where, you're doing here or there and making sense. I don't think that's not terribly meaningful work.
Mm-hmm.
But it's it's some job, even a construction job, right? Or construction or repair or, those are jobs where it's like an identity and it's something you can be good at,
Mm-hmm.
and that people can work at, and it's helpful and they're helping people.
Yeah.
And so, that's for, construction or, it used to be factory jobs, building stuff, making stuff. Now it could be something in computers,
Right.
or technology, and training around that. And then there's also the, I think also the other thing I would say is just sort of the outreach in a sense. It can be hard to reach people, but again, how do we reestablish this sense of community? Whether, and that's what vet centers do that sometimes for veterans.
Mm-hmm.
But how do we, again, how do we not ignore people,
Right. And then, do you think the military is doing enough for the veterans during active duty? Or is that too loaded of a question? Let's
So
just
I
skip that.
don't know the answer to that. So of course, I'm not, I don't work in the military. So, the question is, it's a great one. If you start to see signs of PTSD or traumatic stress or something, or if you have getting back to TBI or something, right? Or to concussion, again, like in football and things, all the stuff says if you have one concussion or something, you should pull them out, right?
Right.
There's a vulnerable period. You don't want to put concussion on top of concussion. And are they tracking that kind of thing? Stress and so forth. And I don't know the answer to that.